Good morning. It was a year ago this week that we put in place one of the first stay-at-home orders in the country. We knew community spread was coming and we had to do all we could to save lives. As we move into the second year of this pandemic, we are seeing the vaccination supply increased, fewer cases of the virus in our communities, and thankfully, fewer deaths. Our Department of Public Health continues watching hospitalizations, the daily case count of new infections, and other markers to help us decide next steps in responding to the pandemic. Meanwhile, we are preparing to receive funds from President Biden's American Rescue Plan. St. Louis County is expected to receive $192 million. We are still waiting on guidelines from the federal government on how to spend the funds, and as the CARES Act funds we received last year, we must make sure that we meet compliance standards before sending any of the funds out the door. We moved the CARES Act funds into the community as quickly as we could, but we also had to do it cautiously. We did not want to risk having to return any of the money. I'm proud of the work of our longtime Merit employees and all that they did in evaluating the grant proposals to ensure that we were getting the money into the hands of the community partners who would use it most effectively. In preparation for receiving the funds from President Biden's American Rescue Plan, I've invited each council member to meet with me one-on-one to discuss our priorities for the funds. With the CARES Act funds, we treated the pandemic as three crises: a public health crisis, a humanitarian crisis, and an economic crisis. And we got the resources to those who needed them the most, from testing to utility assistance. That is the equitable way and the right way to respond to such a crisis. And my priorities will be to build off of that response with these new funds. As I discussed with Council Chairwoman Days yesterday afternoon, we are in this together. The Council, like last time, will appropriate the funds, and it will be up to the Council members to decide how detailed they want to get on how the money is spent this time and how quickly we get it to the residents and the businesses who need help. My priority in the short term is putting more resources into vaccination efforts. As more vaccine becomes available, we will need more sites, more vaccinators, and more infrastructure to get shots safely and effectively in arms. I told council members in the meeting invitation letter sent yesterday that we need to double down on public health investments. Too many health disparities remain in our community, and we must be creative in finding better solutions. In addition to helping small business reopen and get people back to work, we need to support entrepreneurs and invest in programs that get disconnected workers back into the workforce. And as President Biden described it, the goal is building back better. And that project starts right here at the local government level. I look forward to meeting one-on-one with each of the 7 council members to discuss how we can work together to invest in our community and continue to recover from the pandemic. This is a once-in-a-generation opportunity, and we must make the most of it. I encourage residents to contact their council members and let them know how they would like to see the money spent too. Government works best when it serves everyone. And I'd be glad to answer any questions.
Dr. Page, we didn't have any submitted questions this morning.
Okay, thank you.